And we're now going to move to another panel headed up by Andy Krackov. And this is going to be the fun topic of data visualization. So with that, Andy.
Hi, everyone. Thank you, Indu. So the topic of today, right now, is sort of how can we display data in engaging and effective ways? And so that concept, it must have started somewhere, right? So if we can put something on the screen, get this screen going over here. Anyone know what this is right here? Any guesses? It's not from this century, I'll tell you that much. OK, I'll tell you. This actually is the first bar chart, the first published bar chart from 1786 by William Playfair. And so it's essentially, it's a bar chart of imports and exports. It appeared in a sort of an atlas, a political atlas, basically in 1786. And William Playfair, interestingly, he didn't stop there. He also was credited with being the first one to publish a pie chart and also a trend graph, a line graph. So not bad for a career. So OK, one more. See if you guys know this one. Any ideas what this may be? Oh, we got a lot of people raising their hands there. So raise your hands again so I can, because I want to call on somebody. OK, how about right over here in the black?
Is it the color of map?
That's right. Yeah, so for those that don't know, back in 1854, when this map was created, and let me zoom in just a little bit so you can see it better. Back in 1854, there was an outbreak in London of cholera. And John Snow, who was a physician, he was credited with sort of understanding that the source of cholera, people at that time had thought it was sort of foul air or bad air. He realized that it actually was a pump. And part of the reason he figured out it was a pump, basically bad water, was he sort of created this sort of map and helped discover where the actual problem was. The pump that's under Broad Street, if you see the D in Broad Street, that pump was the problem right there. If you go to London now, I think they sort of memorialize it somehow. And so basically, this in many ways changed another way that changed how we sort of saw disease. And for many years, things stayed roughly sort of the same. But over the past 10 years or so, data visualization has really just exploded. Tools have become much more accessible to everyone, much more interactive as well. And we're here right now to talk about this, talk about how it can be used to raise awareness of issues, influence policy, inform consumers. And we're here also to talk about how you can use this in your work. And we've got 4 great panelists, and maybe as I introduce you guys, if you don't mind coming on stage. So first we have Brian Pagels. Brian is with Forum One. He serves as Director of Data Services at Forum One Communications, where he helps foundations, governments, and nonprofits explore opportunities to manage, visualize, and share data more effectively. And then we have Wes Grubbs. Wes is the founder of Pitch Interactive, a data visualization firm. Wes has been in the interactive industry for 18 years and the data visualization field for about 6 years. And Rajiv Bhatia. Rajiv is the Director of Environmental Health here in San Francisco, the San Francisco Department of Public Health. He's kind of a modern-day Jon Snow, and he's going to show us some of the work that they're doing in San Francisco. And lastly, we have Len de Groot. And Len teaches at UC Berkeley's Graduate School of Journalism and specializes in data visualization and data journalism. One recent personal project of Len's includes visualizations of predictions of congressional elections based on Twitter conversations. So with that, I'm going to first turn it over to Brian for a quick presentation. We're going to please, lots of questions we hope, because we want to make this a very entertaining session. So brief presentations, and then we're going to jump into questions. Brian.
OK, so I am going to take us really far into the future from where Andy left off. I'm going to take us from 1854 to 1858. Andy mentioned that for a very long period of time, there weren't really huge advancements that were made in data visualization and data presentation. There's actually a very good reason for that. There are actually 2 very good reasons. The first is that this work had to be done by hand. So, I mean, can you just imagine the amount of time it would require to design by hand any number of data visualization approaches that we have available to us today? So it wasn't really until the advancement of computing technologies and software that allowed us to produce these things kind of on the fly and much more rapidly, that we could begin to kind of experiment and disseminate data in this way. But the other reason is that those initial approaches that William Playfair came up with actually worked pretty well. I came across a blog post in my research, and it was written by a couple of data visualization gurus for a .NET magazine. And they actually said, there's a dirty little secret in data visualization, and that is that the bar chart works really well because it plays into our kind of innate abilities as humans to very precisely compare bars of different lengths. It doesn't work quite as well for pie charts or trying to compare multiple things in a dashboard, but for a very simple bar chart, it actually works really well. And they essentially said that, you know, there has to be a very good reason to do something kind of more advanced. And I think we'll explore a little later on the panel kind of our own personal perspectives on kind of how advanced that should be in terms of creativity and design and whatnot. But this example that I've pulled up here first is what I was referencing earlier. It's from 1858. This is an updated version of it, but it's actually very true to the original concept. And this was actually done by Florence Nightingale. So is anybody familiar with this? Has anyone seen this before? Not a couple, less than 10% of the audience. Okay, that's good. So this is actually a polar area diagram. And what she did, she was a nurse during the Crimean War. She noticed terrible hospital conditions in some hospitals in Turkey where British soldiers were being treated. And these particular hospital conditions she found with the help of a statistician colleague named William Farr. They determined that those conditions actually led to more deaths of soldiers than actual kind of combat deaths. And you can see that in the blue here. That's what she's kind of highlighting. It's really kind of pretty astronomical. And so what she decided to do, her and Farr were compiling this report to present kind of on these conditions. And Farr did not like this idea one bit. He did not want a single data visualization element in this report. He basically said, you know, Nightingale, you're complaining that the report's going to be dry without it. Statistics should be dry. They should be the driest form of reading available. And Nightingale, you know, thankfully didn't listen to him because she knew who her audience was, and it was the public and the Queen. And she thought both of them weren't going to wade through a really long report. They wanted the quick snapshot. They wanted the visual. So this is what she came up with, and essentially it's not the best example in the world, but it was really impactful because she included these in the report, and it actually did lead to impact. It led to a policy change. There was a full investigation kind of following this on hospital conditions for wartime, and it actually improved in later years. So it's a great example of a health data visualization, albeit a very simple one, that actually made an impact, which is what most of us here really are interested in doing. And if we fast forward to today, you know, our kind of design sensibilities have been updated. So something like that isn't going to wow us anymore. It's not going to amaze us. It may accurately present the data in some fashion and clearly tell the story. But if we really want to make an impact, we have to do something a little more like this next example that I'm going to share really briefly. So this is an example that was put together by a data visualization lab. And you can see here it's actually advancing kind of on the fly. But what we can do is if we roll it back to the year 1987, we can put things in descending order. What this actually is showing is the obesity rate across the 50 states. There's more data in the more recent years. And you can see how obesity has grown over time across the board in all these states. So we're just rolling this back 20 years essentially. And then you can play throughout time, and you can see how things have changed, obviously. And if we skip ahead to the end, things have absolutely ballooned. So this isn't particularly complicated, you know. But it's a great use of kind of putting the data in context, using interesting iconography, allowing users to both play through the full series and kind of pause at each year to kind of see the change. And it also kind of sparks a natural competition, which plays to kind of our basest human instincts among states. So again, just one example of updated version of data visualization that kind of we can consider for the future. So thanks.
Thanks, Brian. And next up, we have Wes, and Wes is going to showcase some data visualizations from the healthcare field and beyond.
Great. So this works. OK. I wish I'd known there was some history that was going to be talked about here. One thing I do want to note about William Playfair, John Snow, and Florence Nightingale is in their times, they were punk rockers. This was not a popular theme at their time, and their data visualizations were not widely accepted, especially by the scientific community. Today, we take bar charts for granted, but at that time, that was not the case. Now we're entering a new era of data visualization where we do have large amounts of data and the tools at which we can visualize that. And again, there's controversy. I run a studio in Berkeley called Pitch Interactive. We are a data visualization studio. We work with a lot of different industries. And one of our primary focuses with data visualization is narrative storytelling, and we do a lot of aesthetics. Some people like that, some people don't. I have some words for people who don't, but I won't say it here. So you cannot see this up here right now, but this is a bunch of line graphs that we did for Popular Science a while back for a piece that we were comparing CDC flu trend data with Google flu trend data. And the whole point of the story was, this was the end story that actually came to publication. The story was that the CDC has a huge challenge every year trying to predict flu trends. They have a hard time trying to estimate when to have a peak staff, when to have supplies, and whatnot. And the visualization that we created here was in part of that narrative. This is not an analytical tool set. It's a visual narrative that tells the story of that data. From the visualizations I've seen here today, there's a lot of really interesting data. There's a lot of interesting ways to say that. I haven't seen any narratives, any real stories, because the whole point is data is generated by us, and we are humans. And there needs to be another human way of recommunicating that data out to an audience. I think that's really important. This is another piece we did for Wired Magazine a few years back. This is visualizing 24 hours, basically a day in the life of 311 calls in New York City. And you can see it starts at midnight, it ends at midnight. You can see the total volume of calls throughout the day. We took the top 25 most called about topics for 311. If you don't know what 311 is, it's like 911, but for non-emergency issues. But the piece I really wanted to show is something that we've done very recently. It has nothing to do with any other data set that we've talked about here today. It's about drone strikes. About every year and a half, we like to push away client work and do something that's personally interesting to us in the studio. And this year, drone strikes was actually, it's a very hot topic in the media, and it's something that we wanted to do research. NYU and Stanford made an independent investigation on drone strikes, and as we were reading this investigation, we were really shocked at the actual data. We talked to the Bureau of Investigative Journalism in London, and they were able to provide us a data set of every drone strike in Pakistan ever. And they constantly update this data, so it's a live data set. Anytime there's a new drone strike and it's confirmed, they can update the data set. Maybe I can talk later about how they actually collected the data. But the visualization itself is a narrative. This is a static piece of it, but in order to actually appreciate it, you have to see it in action. So I won't even talk. I'm just going to let it play through. It's cut off at the end, but it's Out of Sight, Out of Mind is the name of this project. Musharraf resigns Pakistan, and then we start seeing a change in trend. Then Obama is sworn into office. This is not meant to be a political piece, by the way. We're not against Obama at our studio. I personally am not. But this is just simply showing the facts. When the animation is done, you can actually roll over and read information about these attacks. Look at the high-profile targets. We are sort of led to believe that I was, before reading this report and informing myself, that drone strikes are super accurate and they're all computer-driven, so we're only getting the terrorists and the big people within our country. When we started looking at the data, we found out that's not the case. One last note, that big gray zone is simply any male between the ages of 14 and 40. Those are not necessarily military combatants. That's all I have to say.
Thanks, Wes. Wes, I think you make a really good point about the need that data visualization is indeed some form of storytelling. But I wanted to ask you, I was reading the other day that it's okay if it takes about a minute or so, as yours did, for that story to be told, for data visualization to sort of unfold.
Right.
And I wondered about that, thinking we live in an age when we want instant gratification, and I'm curious about how simple you think it needs to be. Do we need to tell stories in 10 seconds?
We were asked, why don't we have a skip button? And my answer was, for this, this is not a hotel, with a splash screen. That annoys us, even me. It makes my blood boil when I have to wait. But in this case, I want to force a story. I want people to see the story because they have to in order to see the visualization. I don't want instant gratification. But that's me. I'm the storyteller in that case. It's when we go to the movies and we see a movie, the movie has to play out. There has to be a plot. There's a climax. There's a trough. How does the movie itself play out? And in many ways, we're sort of taking that ideology and putting it into a 3-minute clip.
Great. Thank you. And next up is Rajiv. He's going to talk about some of the stuff that's going on here in San Francisco.
Hi, so I'm Rajiv Bhatia. It's on my screen? Okay. So I'm going to tell two stories. I think I need to be over here. Two stories about the way we've used data in San Francisco for policy change. The first story has to do with development in San Francisco. And if you recall, about 10 to 15 years ago, we began to plan for a major scale growth of residential development in San Francisco. And most of this development is on the eastern side of San Francisco in areas that are either very well developed, that were industrial areas or mixed use areas, and were generally the lower income areas of San Francisco. Well, not everyone was happy about this. There were fights. There was a change to district elections. There was a lot of controversy. And what people were saying was, you are not planning for us. You are not planning for better homes for us, better neighborhoods for us, better parks, better schools. You're planning for someone else. And this critique was registered not only by the planning department, but also by the health department. And they asked the health department to intervene. And something we did, and it was a collaborative exercise in 2004, is that we pulled 30 different community organizations and 12 city agencies together and said, how do we measure healthy growth and development in San Francisco? And we came up with this, which is now called the Sustainable Communities Index, about 100 different measures of measuring quality of life and basically the conditions we need to have a healthy population in the city. And we had a lot of lessons from this, and I'll share one. We were planning for this growth in areas that were really pretty well served by transit and where the jobs were. And it made sense and it was rational from that perspective. We weren't planning for other things. For example, the areas we were planning all this new housing and have been building all this new housing are the ones with the poorest quality of school access, the least proximity to schools, and some of the least quality schools. They're also the areas with the least park access. So those are two examples, but we presented a variety of examples of blind spots in the planning process through this data's visualizations. The result of that was greater collaboration between the planning department and the health department, and community groups using this data to demand better services, more resources, and better neighborhoods. A second story has to do with pedestrian safety. I don't know, you're in one of the cities with the highest pedestrian injury rates in the country. We have 800 injuries a year. That's been steady for the past 10 years. We have 100 serious and fatal injuries a year. half of the fatalities, traffic fatalities, occur among pedestrians. It's a pretty significant problem. But we weren't planning for pattern. We were sort of attacking one intersection at a time. We were doing one intervention at a time. And we were basically waving our hands and saying, it's that person's fault. It's either the pedestrian's fault because they're stupid and they use cell phones. Everyone, right, uses cell phones. That's not so smart. Or it's the driver who's homicidal. But that doesn't really help anybody, right? There actually are environmental causes. And so we took the maps like this, which show, okay, look, a bunch of random dots on a map, right? I mean, what's the pattern in that? And we transformed it into something like this, which is where these lines are looking at traffic injuries as a street phenomenon, a big intuition that the causes of injuries actually are related to the qualities of the street. It wasn't pretty hard, and what this map shows is that 55% of the serious and fatal injuries happens on 5% of the street miles. So this was a pretty transformative map. It got the police department to actually go to those streets. It got the transportation agencies to begin to start to direct resources and interventions towards the streets that are causing the problem. So this wasn't new data. It was existing data, but the way it was communicated, and I think the point that Wes made, it was communicated with intent, with purpose, to tell a story that was really intended to lead to change. And so a couple of points about, around what I've learned around data storytelling and data visualization is, number one, if you're serious about using data for social change, have a purpose, right? Focus on a priority problem, issue, or need. Don't focus on your issue or need. Focus on one that's already an active policy issue in the community. Disrupt an established narrative. We're typically stuck in not solving problems because we're thinking about in the same way. We need to open up the problem narrative. We need to get new ways to thinking, and data can disrupt that. Expose injustice. Contribute to knowledge. Again, we don't have to collect new data. Visualizing the facts showed how conditions in different neighborhoods varied, and that was sort of a powerful communication tool. And finally, inspire and motivate. Demonstrate on accountability, show a way forward, and tell a story. And finally, and I think it would be really great because we did all this work and we didn't have the aesthetic tools. And I think that if we had had some of the aesthetic tools and the design thinking and communicative thinking, the support of journalists and graphic artists, we could have really done this much more powerfully. And I hope that's the next phase of our work in collaboration. Thank you.
Thanks, Rajiv. I want to pick up on what you were just asking, or you can sit down or stand up or wherever. But this concept of whether it needs to be beautiful for it to be effective, is it fine if it's just serviceable? I mean, your stuff, quite honestly, looked pretty beautiful, but what's your sense of how beautiful it needs to get to be?
Well, I think if it tells the truth and it leads to change, it's beautiful, right? I mean, but does it need to be? I mean, I think that it makes it, if we can get people to pay attention, I think with all of the information out there, we really need people to pay attention, and that means many qualities. I think, what does beauty mean? I think I'll let others speak to what beauty means when we're talking about the visual representation of data, but being simple, being clear, being really showing the knowledge and sort of getting rid of all of the crap around it, I think is important. But yes, I think it needs to be as beautiful as it can be.
Beautiful and simple. Next up is Len, and Len, he teaches data visualization, so he's going to give an introduction to some of the skills and the tools and the resources so that we can all start making some of these on our own, and gives us some tips along the way too.
So I'm supposed to tell you how to do all of this in 5 minutes. If I don't make it, forgive me. So getting started is, how many of you are communicators again? A few scattered around the room? Okay. So there are a few, we only have a few minutes, so I'm only going to touch on a few things that you really need to know to get started. And we are talking about communication in this case. So, all right, so raise your hand. Raise your hand if you use spreadsheets on a regular basis. Great. Keep your hand up if you're a communicator. And how many of you communicators are using spreadsheets? Just a few. So one of the disconnects that seems to be happening that needs to be addressed is the people who are producing the data and the people who are telling the story of the data need to talk. They need to be partners in the process. right? So that means that the people who are the communicators need to learn some spreadsheet skills. They need to learn about statistics so they understand what the data people are doing. And the data people need to help them. We also have to learn about design, right? Design can mean many things, but in this case, in communication, we're talking about leading the reader or your user through the content, right? And we do this primarily with hierarchy, right? So start here, go here, then there. And hierarchy can take a lot of different forms. It can be type, in this case, it can be size, it can be shape, and it can be color. So this is a quick example from the New York Times. Hold up your hand if the first thing you looked at was the map on the left. Hold up your hand if the first thing you looked at was the map on the right. Why? It's darker, right? So it's a hierarchy of color, even though those things are the same to size. And we often think that people read top to bottom, left to right, and that's not necessarily the case, right? People will go to the hierarchical lead in whatever your visualization is. Knowing that will help you get through the process and really make your communication more effective. So I'm glad I'm getting a laugh. So I was a little worried. There were very few jokes earlier in the day. So as you've heard, right, making a point is really critical, and it doesn't have to be extravagant to do that. I mean, a lot of times we just have to take an extra step in how we're thinking about our communication. I have a kind of a goofy fictional example, right? Annual healthcare costs per capita, right? And somebody who's going to spend a little bit of time can look at this and say, okay, well, the US has a much higher rate when people start reaching retirement age, right? A simple change, a very, very simple change, can help make that communication more clear, right? So if your communication, if your text, your annotation reinforces and guides the user through the visualization, that can help tremendously in your communication. There are a lot of free tools. So how many of you have a Google Drive account? Great. How many of you have created a graphic in Google Spreadsheets? Just a few. Okay, so Google Spreadsheets is a great place to start if you're just getting started. It's really easy. The graphics, you can get an image out of it. You can get an embeddable graphic for your site. It's a really great place to start. Tableau Public is also really great. It's PC only, but it will let you do more things. There are different types of visualizations available, more robust kind of visualizations. There are a few new things. I think one of the newest trends in visualization are services that kind of automate the production. Two of them are iCharts.net and Infogram. The thing to remember is that these things are starter tools, right? And they're not a replacement for good judgment. Yeah. And finally, resources. So kdmc.berkeley.edu, my site, we have about 120 free tutorials that cover everything from basic data viz to GIS to a lot of different things. So there are a lot of resources like that out there. If you decide there's one thing you want to learn, there are almost always communities around that thing. So Google groups around, say, Google Charts or Excel charts. Stack Exchange, I think that was mentioned earlier this morning, is a great resource to go and ask questions when you run into problems. If I have the chance to pitch two quick books, neither of them mine. One is The Functional Art by Alberto Cairo, which is a really good introduction to both visualization and context and how to marry those two things. And the last is something called Naked Statistics. A lot of us took statistics, were forced to take statistics, got out of class, and immediately forgot it. This is kind of statistics for the math phobic. Good? So it's a good place to start. That's it.
Thank you, Len. So, Len, I have a question for you, and I want to follow up and ask everyone else, too. I suspect there's a fair number of organizations out here who, sort of springing off your presentation, I'm curious, they may sort of want to know what first thing should they do tomorrow when they get back to the office to start to move in a more visual direction in terms of data. What are some quick, easy steps? Maybe downloading these things, but what are some quick, easy things you can suggest they do?
If you're starting from scratch, start small, start easy. Just throw some data into a Google spreadsheet and make a chart out of it. Just don't. A lot of times people try to start with visualization and they go for something like Wes's great work, right? That's not where you want to go if you're starting. But,
Great. Brian?
Yeah, I mean, I would say the first thing to do would be to, along the lines of what these guys were talking about, is figure out what data you have and what story you want to tell. And then start kind of applying that by using some of these simple tools. I guess the other thing, if I may offer one other, would be just to look for inspiration. There are a lot of good options out there, and again, you don't want to bite off more than you can chew at the beginning. But looking at some of the examples that were presented today are pretty awesome places to start, as well as great blogs like Information is Beautiful and others. So I think those are pretty important.
Great.
Hire a fine arts person is what I would say. I mean, don't try to be a designer. If you don't feel comfortable in that realm, don't. I mean, color is really complicated. We take it for granted because Excel gives us our 16 colors to choose from. But if you look at Josef Alber's background of color theory and how colors impact each other, relatively speaking. I mean, color is the most relative medium that we have, and it's so overlooked. There's typography, there's alignment. Those are just the basic foundations of really good design work, and we shouldn't all try to do that. Find fine arts people, and whether they're watercolor painters or just somebody who's passionate about doing really creative stuff, and let them tell you what they think about the work that you're making, and then pay them well. And and then do what they tell you to do. I mean, that's a really great way to make your visuals much more impactful.
Yeah, I think of just picking up. I think have a really powerful story to tell. Have a change purpose. I think that will inspire a team, and then you may not have to pay your designer so much because they're so inspired by what they're trying to change. Right? Wes will pack up his team for a month, and they'll go off and do it because they'll be so inspired. But yeah, start with purpose and question your data. I think you may think you have the right data, but what are other data sets? You think you may be the first person looking at this, but probably hundreds of people have looked at this in other ways. See how they've already done it, and see what you can add and contribute.
I want to open it up to questions from the audience. So why don't people who have questions, if you don't mind getting near the microphones, so you can ask away. I see one person walking over here.
Actually, it's just a comment because I want to reinforce the idea about things looking beautiful and having a narrative story. But I also have to ask you, in the public sector, when you're using the public dollar, sometimes using design or paying people for design can, at least my experiences, can rile up the public about how you're using the public dollar. I don't know if anybody's had that experience.
Yeah, I would say, do you want us to be effective or not?
Yeah.
I think that we shortchange the public sector in so many ways. We don't have communication professionals. We don't have design professionals. And we look unprofessional.
Have you faced instances in San Francisco where the public has been riled up because of the dollars that may have been, or things that look nicer?
No, we don't spend any dollars on looking professional
So it hasn't been an
and
issue.
good. So,
There you go.
yeah, we have to buy our own clothes and things like that.
I mean, Minneapolis is a great example of a city. Minneapolis and St. Paul is a city who, in the last decade, have really invested into the arts community of their city, and it has reinvigorated that city. I mean, it's a beautiful city now, but it's full of art, it's full of creativity, and I think that's interesting. I guess one quick thing to add is I'm not a designer by trade. I have a degree in international economics and information systems from Arkansas, so that kind of makes an interesting twist. But yeah, I mean, design for us, it's what I've learned in the last 18 years of doing what I do, is that design is crucial in communication.
One of the things to remember is design is not necessarily just how things look, but
Yeah.
it's how things work, right? And you're creating something that someone can actually work with. And if you're creating a tool, then that's really important.
That's a good point. Yeah, over on this side.
Hi, Matt Willis, Public Health Officer for Marin County. Thanks. This is super exciting to be here, I think, at this stage of sort of evolution of understanding of data and how to communicate. I previously worked at CDC, and I sort of thinking about audience and tradition and culture around information. When we would have presentations from CDC, there was a sort of an inherited branding, if you will, that went beyond branding, but to sort of culture and the way scientific narrative is expected to be constructed in that environment with colors dictated and format dictated as a means of expressing in ways that the audience was sort of conditioned historically to interpret. So providers, the medical community, the scientific community, there's a lot of sort of baggage and history there in terms of what's acceptable and as the way information is portrayed. And when I look at the drone strike example, for example, it's super innovative and new as a way of portraying that information, but potentially that's actually also a liability if there's a way sort of culturally that information is expected to be portrayed. So I'm just wondering sort of how to navigate the fact that we also sit in a position of history and tradition around what's expected about the way information is portrayed.
Yeah, I mean, I'll take that on. Again, it goes back to effectiveness. We're largely communicating to each other in the professions or in disciplines, and it's horribly ineffective, right? I think we need to communicate to the people. We need to be motivating people because they're going to be the ones that that have the voice to change things. Even communicating to policymakers, to me, is suspect because the policymakers are supposed to be listening to people. So I think really robustly communicating to people, and if you do it and you get scolded, oh, you didn't do this in the sort of the journal format or the science format, I think you just stick with it. I think you will develop a constituency for what you're doing that will keep you safe.
I mean, I've been asked that question a lot about the cultural values of like colors and how people might perceive that. This is a very globalized world, and I think people who are stuck on localizing their styles based on local cultures, that's part of the 20th century. I mean, look at Apple Computer. Do they adjust their visuals so that people of other cultures will accept it? No. I mean, maybe that's me being a little bit more provocative in that regard, but I think we need to focus on the story that we're telling and try to engage a broad audience. And if it deals with a cultural aspect, just be aware of, what might be the case, but stick to your guns at the same time.
Any other comments?
Yeah, I do too, but go ahead.
Well, I would agree with both of those points, but I would just add that I think we also need to be I think we should be pushing the boundaries, and I think to a certain extent we also just need to be a little patient, just cognizant of how quickly things have evolved, especially over the last 10, 15 years. And yeah, some people and some groups just haven't quite caught up yet. And that doesn't necessarily mean we need to stop doing it, and it means that, yeah, those kind of old ideals will pass probably over time. There's just a little bit of a lag factor.
The newsrooms are typically very conservative, at least in terms of change. If you have any questions about that, look at their revenue model. So doing graphics inside of a newsroom was a battle for many, many years. And it was a fight for respect. And there were a lot of battles that I lost and some battles that I won. But it is oftentimes a gradual progression. You take a victory and you build on it. And sometimes it also means asking for forgiveness instead of permission.
Great. Over on this side now.
Hi, thanks for the panel. This is Alex Tam, Frog Design. So, I love the work. It's amazing. You're taking disparate amounts of data and you're making it gorgeous, and you're raising awareness around the meaning of all of that data. So the question I have is around, I'd love to hear some comments, examples, tips on the next step of turning awareness into action. So, what's the best way to take that data, visualize it, and then get people to actually do things with it or make decisions based on that?
And if folks have specific examples that they've seen that have been effective in that realm, even better if it's health related, that's great, but any thoughts?
I mean, I can start again. I think all of the data we've collected has translated into new ways of working between city agencies, new policies, new actions, and I think there's some pretty simple reasons. We provided data based on a constituency's request for that data. So the audience was there. They needed evidence, they needed information, they needed it presented and presentable, and then they were able to take it and use it politically. So we didn't go off and do what we thought was important. We provided the information for what others thought was already important. I think the second is that we didn't tell people what they already knew. We presented new, sort of new ways of looking that sort of got the perspective to change. The traffic injuries weren't a behavioral problem; they were an environmental problem. We shifted. I think we were able to shift the narrative. So I think there are those. There's some very sort of clear sort of ideas, and I think where you're very purposeful and thoughtful of the theory of change that the data is operating in, you can be very effective. If you go off and just do the data as a research exercise, or this is interesting data, or here's new data that no one's ever collected before, you're going to be kind of out of context. I think a final point is the problems we sought to address, and this is very different than other public health agencies or approaches, weren't public health problems. I have never worked on obesity. And I'm not going to raise up a problem as a public health. I'm going to look to see what are the problems the public is identifying as problems, like displacement or the need for parks. And I can use that to address issues like obesity. But I'll focus on where the politics are right now.
Brian?
Yeah, so in terms of kind of health data resources for impact, like how do you actually get there? One example that my company, Forum One, has worked on for the past 4 years is county health rankings, and I'm assuming a large percentage of this audience is somewhat familiar with that project. It's run by the Robert Wood Johnson Foundation and the University of Wisconsin's Population Health Institute. From kind of a visual perspective, there are a series of presentation tools that are used. There are chloropleth kind of heat maps by county. There are tables and rankings and the ability to compare. And a lot of those similar examples we've seen today. But in terms of actually turning that into action, the kind of second half of that project is county health rankings and roadmaps. And so when you're kind of evaluating kind of the relative status of your county, you can choose to select to view particular options for how you can start to make an impact within your county. So it could be something as simple as writing a letter to a representative, or it could be something as complex as program design. But it gives you some kind of options and templates and ideas to use. And it has made an impact over time, at least qualitatively, because a lot of communities who are historically ranking pretty low have begun to implement programs and started to change the course. We don't have enough quantitative data yet. It's just too soon. The project is too young to tell what kind of impact it's making quantitatively, but qualitatively, there is an impact. I think some of it's due to visualization and some of it's due to the connection to specific actions.
Yeah, one of the other things too, real quick to hit on that, is when you're talking about engagement, you're really talking about is something actionable, right? And there are different varying degrees of actionable. There's the kind of the very kind of low-hanging fruit, but really good stuff, like on health inspections for restaurants, right? But there is in data there's drama and there's pathos, and there are things that we can find there that will help us tell our stories, whether it's drone strikes or whether it's who were the people who suffered after a tragedy they didn't need to because of their societal or their health impacts, right? So I think it's partly looking for those things and surfacing them for people.
Great.
Yeah, wonderful, wonderful panel. I'm so happy you're here. I've been waiting and waiting for the visualizers to show up, and you all had such beautiful examples. And I guess I just wanted to add one thing. I'm a content strategist, and I've worked on a lot of health projects, probably maybe 50 to 100. And over a period of a couple decades. And I see this great moment, this teachable moment when you have this data visualization or some kind of visualization and people get it. But then the rest of the experience generally doesn't continue in the same visually compelling way. And what I haven't heard here today is people this last comment was sort of alluding to it, but going through the actionable stream, you've arrived at the teachable moment, but you still have to convert that, and it's the conversion that is the tricky part, that is the, why it matters at the end of the day. And part of that has to do with user experience. And what I am sort of observing in the community is very little emphasis placed on researching what users make of what you make. And I'd like to hear more about that and if that's happening.
I think that's a great point. I mean, and as far as actionable items, it's really hard to measure the outcomes of your visuals. I mean, the drone strikes piece that we did, it got so much publication, like by the end of the week, like I was fried. Like I was not expecting. I had people knocking on our door at the office, not to mention hundreds of emails every day. It was on Iranian news, on Pakistan. It was everywhere. Everyone was talking about it all of a sudden. I was just hoping that maybe Obama had seen it himself. We almost highlighted the point where he got his Nobel Peace Prize, but that would have. No, I didn't want to stick him too hard with that, and that was irrelevant at that point. But I think as far as measuring the outcome, those actionable items, it's very difficult, and I think that's sort of the next step that we need to really challenge ourselves with, especially with government data that we might be taking to help people understand pedestrian accidents. Like how can the visualizations that we create, how can that impact and change accidents and deaths and and whatnot. So
the work we did has never been divorced from other people. I mean, we've always worked in collaboration, so we're providing the data, and that's our technical contribution to a collaboration that's trying to make some change. So I think that's a point that I think I've been trying to say, and that's very important. So we don't have to be doing all the pieces. We can collect the data and visualize it, but other people are doing communication. We're not alone. When we did the Sustainable Communities Index, we went through about 300 measures, and others in my team are here. Cindy's, I think you heard from her early. She was there too. And we had these different groups, and we had put the indicators up, we had mapped it, people critiqued it, they said this speaks to what we feel and what we mean, it doesn't. And so it was a very interactive process to get to the important facts and the important ways of conveying those facts that were what people wanted to express. And I think that was a part of making it effective in policy change, too.
I think we've got time for one more brief question.
Yeah, thank you. I will be brief. I was particularly interested in your comment, Len, about resources to learn. And it occurs to me that we have a genuine literacy problem, data literacy and visualization literacy. But my question is, based on this lack of literacy, how are we going to get to a point where ordinary people who are not trying to tell a story or seek a specific answer, but just make general life decisions about health, are going to be able to do dynamic visualization analytics? For example, when I saw the obesity chart, I immediately wanted to know what's the correlation with snack food sales. So these are the kinds of things that occur to people kind of dynamically, not the storyteller and not the researcher. So how far are we, and what do we need to do to get to this kind of point where ordinary decisions can be made dynamically with an interactive kind of visual aid?
I think there's a big movement within the data viz community right now to kind of automate some of that stuff, right? So if you throw in some data upload it into a site, it will spit out your correlations. You can say, give me correlations between this and that, and it will kind of do some of that analysis, right? So I think, and it's always risky to do predictions, but I think that what we're going to see is better and better tools that take some of the programming out of it, and we'll get better results based on that. In terms of non-communications, but just educating the populace, I mean, that starts with the education system. Yeah? Am I understanding the question correctly?
Yeah, there's definitely a literacy issue, but there's two parts. We need to raise the bar of the population so people can create effective data and effective visualizations. Right. And then we need to do the technical transformation to make it genuinely useful dynamically.
Yeah.
So I mean, maybe the next phase of our work is not keeping the data ourselves and owning all of the visualizations, but making it open data. And so what we've seen, we've been creating dynamic maps for, people don't want to look at 90 indicators at a time. They're looking for the thing they're looking for. So the housing affordability or pedestrian injuries, there's a dynamic map. You can look at an area, a street, or the particular intersection that you want. Another very exciting sort of, once we put this data out there, other people who are very effective app developers and data retailers are going to take our data and do that. There's going to be a marketplace, and there's going to be competition, and the successful developers will provide the data retail products in the way people want.
Great. I want to thank the audience for the great questions. I want to thank the panelists. Great presentations.